come from and how you chose our center for the rehabilitation of Mr. Diab, of your son?
Yeah. First of all, I try to find any electronic system to help my son to walk properly, especially for his right leg. So I contacted different companies who produce these instruments, rehabilitation instruments.
Do you refer to the Bioness?
Yes, I contacted Bioness because I saw their system on the internet, their website. It looks good for my son. I contacted them. They told me that they are not dealing directly with patients, and we have to check. And you have to check first if you will get any benefit from this instruments or not. And they recommend for me to different centers. One of them is Evexia, to contact them to see this instrument there to be tested. If it will be okay with him, they can send it to me.
You're also a doctor,
yes.
So I suppose you will have a good awareness of that instruments, and that's the basic reason you want to search before choosing a center. And
then I searched all the centers they told me, one in Italy, one in Israel, one in Greece, another one in Germany, Switzerland, and I found your center here, which is very well organized regarding what I need. I don't need a very big hospital with all departments. One of them is physiotherapy. I need only a physiotherapy center to look after my son.
So you need a specialized neurorehabilitation center?
Yes, yes. And also your website is very informative. All what you want you can find on it. And once I contacted you, I think you replied for me from first time.
I work for the International Pension Department.
And you were very helpful with me. Every points which I am asking, there is an answer for it, especially at the time of getting the visa, entry visa from Greece embassy. And you send me the protocols. I managed to finish everything before we came here. And the most important that I had the decision to stay with my son for 3-4 days.
Yes, you're going with your son.
Just to check the center, how the work is running, how the doctors deal with the patient, the physiotherapist how to deal with the patient. And I found all of them very helpful and up to standard. Because I have a great experience in Germany with 2 different physiotherapy centers, in Egypt with 2 different physiotherapy centers also, and we spent a month, about 1 year in a center in Egypt and about 4 months in Germany, and I have some concerns regarding their system. They are very helpful only in the first day, and after that they leave the patient to do what he wants. If he would like to have the session at 9 o'clock, okay. If he relaxed and don't like to get it, he would like to postpone, they postpone. There is no fixed system for my son, and a good follow-up.
So there should be more specific program?
Yeah, and it must be supervised with a doctor here, and he has to follow up the progress of my son. If he needs any modification of the program, he can do it. This is important because your doctor here is available all the time. But in Germany or in Egypt, they are not available. They only available for 1 hour per day. So if you can catch him, okay. If you can, you have to wait for the second day, or maybe you have to wait for a week to meet him.
Your son's wife will be here to accompany your son, so whenever she needs any access to the doctors or to our medical staff, they will be at her disposal. You should know that.
Yeah. And actually, as with Dr. Stefas, I spent about 10 minutes with him, and I have complete confidence in his experience in this field. So I told him if my son needs any further intervention, like Botox injection or whatsoever, I will agree. Just I asked him to send me an email. You would like to do so and so and so. I will accept, and even if this was extra cost, I have your bank account. I will transfer the money to your bank account to cover all the expected steps
towards his rehabilitation. We are very glad to hear that the medical staff satisfied you. With regards to the therapeutic staff, the physiotherapists, what is your opinion?
Actually, I am not in direct contact with them, but my son in direct contact with them.
So
and when I discussed this with him, he is more than happy with all of them. All of them very friendly, and they are very helpful, and they make a good, it's not a relation, but it is a good social feeling between both of them. So this is very important for any patient, not for my son only. He has to feel that he is working with not a physiotherapist, maybe with his friend or colleague or whatsoever. So he is very happy with all your staff here, who is running for him the sessions or whatsoever the type of session, even occupational therapy or physiotherapy. And we will check for the hydrotherapy today to see what will happen in the swimming pool.
Okay.
Yeah.
Yes. I will be expecting more comments after that.
Yeah.
And well, with regards to the infrastructure, those departments that you have seen so far, are they sufficient for your son rehabilitation? What is your medical opinion? How is our center's infrastructure?
The infrastructure here is it is very suitable for what you are doing. No need for more.
But do you have any difficulty to come to and fro from the hotel to the center? What is the time expectancy? Do you have any difficulties?
No, but
it's close.
It's very close. Maybe by summer the road will be a little bit crowded, but it's 5 minutes to 10 minutes from the hotel to here.
And it's also the first time you come in Greece.
Yes.
What is your impression?
But I have the feeling that it is like Alexandria in Egypt. It is the people is very, very friendly. They have a good behavior for foreigners. Maybe because this is a touristic area. Maybe this area it is a touristic area, so they are acquainted to deal with foreigners.
So we speak. Everybody speaks English in the center.
Yes,
so we don't have any
this is a very important, because we went also for a physiotherapy center in Ukraine, and we spent there 1 month. We can say nobody speak English there. Nobody. Only in the center, only one. If you would like to ask for something, we have to search for him to translate.
Yes.
Even we cannot translate through, sometimes you can translate through Google Translate, but the Russian language is a little bit difficult, and most of them speak Russian, no English. So we faced a lot of problem there because of the there is no good communication.
Yes.
Even if you'd like to ask a doctor about something, he can't understand me and I can't understand him. We have to wait for another one to come to
But here there is no need of translator, because
No, no,
there is
no.
direct contact with the physiotherapist, with the doctor, with
Yes.
the personnel in the
95% of all people here speak English in very good way. And at least we can understand each other. This is very important.
Yes, and
Yeah.
this is very important for your son to be treated like he is a friend, as you said. Like we are very glad that you express that feeling.
Yeah.
And in the future, would you recommend our center to anyone that who needs rehabilitation?
Yes, this is actually what I discussed with my son and his wife yesterday and yesterday before. I will leave to Cairo tomorrow, and the first thing I will contact all the patients who were with my son in the physiotherapy center in Cairo. I will contact all of them to recommend your center for them. Really, it is a very good place, very helpful people, and actually in Egypt there is a center there. They have all up-to-date instruments. They have everything, swimming pools. They have all the tools. They have everything, but they don't have the system how to follow up the patient, how to put the right protocol, how to evaluate the protocol every few days to change it according to the situation of the patient. They never do this. So I will recommend your center for them. If I succeed even to convince only one to come here, I will be very happy. And I do my best, because there is another center in Egypt. I will contact them to put your center with them in contact.
Maybe we could cooperate.
Yes, definitely. I asked about any Egyptian patient came before here. Most of them told me no. There were no Egyptian patient came here for a treatment. My son is the first Egyptian guy to come to here for, and I'm sure he will not be the last. I'm sure. And maybe according to his case, we can extend our stay here for another 1 month. If his case needs this, we will do this. And we recommend definitely your center for the Egyptian patient to come here for rehabilitation.
Yeah. Thank you for your kind words, and thank you for
very much.
Valuable time that you devoted to us for the interview.
Please, thank you.